let me introduce the next speaker. The next speaker is Dr. Kenji Efwe. So Dr. Kenji Efwe is a senior scientist at the Research and Development Laboratory of the Kato Ladies Clinic in Tokyo, Japan. Kato Ladies Clinic is the largest IVF clinic in the world. He obtained his PhD degree in agriculture from the Tokyo University of Agriculture and Technology. His research interests include fertilization, embryology, cryopreservation, and blastocyst implantation. Dr. Efwe has participated in an extensive number of scientific publications in high-impact journals. And today, Kenji will share his article about ultra-fast warming, recently published in Human Reproduction, and we'll discuss about the current protocols and solutions. So please, Kenji, we are ready when you are.
So thank you for your kind introduction. Sure. Can you see my slide?
Yes. Can we see the presentation?
Okay. So thank you for kind introduction, and I'm honored to have this opportunity. And today I will discuss recent advances in warming procedures, focusing on solutions and protocols. So this slide is the outline for this presentation. And first, I will talk about our recent studies on fatty acid supplemented warming solutions. And then I will address the impact of shortened warming procedures when we utilize the fatty acid supplemented warming solutions and non-supplemented solutions. So let's begin with the first topic. As you know, the cryopreservation technology for human oocyte and embryo has substantially progressed in the last 2 decades. However, recent publications have indicated that oocyte vitrification reduces developmental competence and live birth rates. Additionally, oocyte vitrification impacts the distribution and the function of mitochondria, chromosomal segregations, and zonal pellucid properties. From this result, we consider that some modification to solutions or protocol are necessary to improve clinical outcomes. So to devise a strategy, we reconsider the principle of vitrification and warming. During vitrification, it is essential to equilibrate the cells with cryoprotectants to prevent ice crystal formation. So ES contains EZ and DMSO as cryoprotectants, which diffuse into the cells. The next step is DS, which has higher concentration of EZ and DMSO, and also contains a non-permeable cryoprotectant, sucrose or trehalose, resulting in cell volume shrinkage due to the dehydration. Similar to ES, EZ and DMSO diffuse into the cells. And the embryo warming process includes 2 critical steps: the removal of permeable cryoprotectants and rehydration. At this time, I'm focusing on the removal of cryoprotectants. TS is a liquid with the highest osmotic pressure during warming process, and this solution expels cryoprotectants from the cells. And in DS and WS, permeable cryoprotectants diffuse out from the cells. To improve the vitrification outcomes, we have focused on one of the permeable cryoprotectant, DMSO. As an amphiphilic molecule, DMSO may influence the lipid droplet in the cytoplasm during the vitrification and warming procedure because DMSO may dissolve the lipid droplet in cytoplasm. Therefore, we previously examined the impact of vitrification on the lipid droplet in mouse oocyte. And our result demonstrated that vitrification significantly reduced the lipid droplet in all plasma. Lipid droplets serve as a storage for lipids, such as triacylglycerol, TGC, and the TGC are broken down into fatty acid, and then transported to mitochondria. And through beta oxidation, fatty acids contribute to ATP production. Therefore, we hypothesize that the loss of lipid droplet observed after vitrification may be associated with a reduced developmental competence. And we also hypothesize that compensating for lipid droplet could improve embryonic outcomes. At first, we speculated on the mechanism of how lipid droplets decreased during vitrification and warming. We hypothesized that the reduction of lipid droplet occurred when the DMSO removed from the cytoplasm. We also consider that adding fatty acid to warming solutions may increase the fatty acid and lipid droplet in cytoplasm. And our recent study demonstrated that vitrification decreases lipid droplet in cytoplasm. However, adding fatty acid to warming solution can offset this effect. We confirmed this positive effect in mouse oocyte and human blastocyst. Furthermore, the fatty acid supplemented solution improves the competence for embryo development and blastocyst outgrowth. Additionally, this solution improved pregnancy outcomes after frozen cleavage stage embryo transfers and after frozen blastocyst transfers, without any adverse effect on maternal and perinatal outcomes. Therefore, we consider that the use of fatty acid supplemented warming solution is an effective option for enhancing clinical outcomes. The next topic is a shortened warming protocol. As I mentioned earlier, the embryo warming process involves two critical steps, and at this time, I'm focusing on rehydration. Embryos are first warmed in TS, therefore, dehydration occurs in TS. The embryos are then gently rehydrated through multiple dilution steps in DS and WS to prevent rapid rehydration. The presence of DS between TS and WS helps to prevent rapid changes in osmotic pressure. So contrary to previous theories, the shortened warming protocol, such as ultra-fast warming, has gained attention. In the shortened protocols, embryos are directly transferred from TS to recovery culture medium or WS. Therefore, it improves workflow in embryology laboratories. Furthermore, the previous presenter clearly presented the clinical outcomes using shortened protocol are comparable with or even better than those using conventional protocol. However, the in vitro evaluation of this protocol has been limited, and it remains unclear whether this protocol has any adverse impacts. Furthermore, as I mentioned earlier, we have developed fatty acid supplemented warming solutions. The embryos are assumed to intake fatty acid in DS and WS. Therefore, embryos may not have the opportunity to intake fatty acid when the shortened protocol is applied. So to investigate the impact on the shortened warming protocol on blastocyst viability and fatty acid intake, we conducted several experiments. In this study, we utilized 267 discarded vitrified human blastocysts that were donated for research by consenting couples. These blastocysts were vitrified using the conventional protocol. They were randomly assigned to 4 groups based on the warming solutions and the protocol: the control conventional, control shortened, fatty acid conventional, and fatty acid shortened. In the shortened groups, so in these 2 groups, the blastocysts were immersed in TS for 1 minute and then cultured in recovery medium for 2 hours. Then we evaluated embryo volume recovery, cell viability, intracytoplasmic lipid droplet, and outgrowth competence. So we first observed the changes in blastocyst morphology during the rehydration. So as you can see, the degree of blastocyst volume recovery was significantly higher in the shortened group than in the conventional group. In the conventional group, the blastocyst volume gradually increased in WS and reached 97% of the intra-GP volume at 5 minutes after immersion. However, in the shortened group, the blastocyst volume rapidly increased in the recovery medium, and the volume already reached 100% of intra-GP volume within 1 minute, and then reached 111% at 2 minutes. We then examined the blastocyst viability after the recovery culture. Notably, all the blastocysts survived at 2 hours after recovery culture, and the re-expansion status after recovery culture were comparable among the 4 groups. Furthermore, the incidence and the number of spontaneous blastocyst cropsies during recovery culture were comparable among the groups. The distribution of lipid droplet was also examined using Nile red staining. The amount of lipid droplet was comparable between the controlled conventional and controlled shortened groups, and lipid droplet were significantly increased in the fatty acid conventional group. However, lipid droplets were not increased in the fatty acid shortened group. We then evaluated blastocyst adhesion and trophoblast migration ability using in vitro outgrowth model. The blastocysts were plated on fibronectin-coated dishes following the ZP removal and cultured for 96 hours. The adhesion rate, outgrowth area, and outgrowth degeneration rate were analyzed. Embryos were classified as degenerated when the outgrowth area decreased by more than 10% compared to the maximum outgrowth area. When we look at the blastocyst adhesion, the adhesion rate tended to decrease in shortened groups. However, no significant differences were found among the groups. Additionally, when we use non-supplemented solutions, the outgrowth area tended to be larger in conventional groups compared to the shortened groups, but these values were statistically comparable. Conversely, when we applied fatty acid supplemented solutions, the outgrowth area was significantly larger in the conventional group than in the shortened groups. Furthermore, there were no statistical differences in outgrowth degeneration rate amongst groups. So overall, our data indicates that the shortened warming protocol did not impact the expansion status or the occurrence of blastocyst cropsies. Furthermore, the shortened protocol did not affect blastocyst outgrowth when non-supplemented warming solutions were used. The fatty acid supplemented solution enhanced the blastocyst outgrowth when using the conventional warming protocol. However, this benefit was not observed with the shortened protocol. So based on these results, we believe that shortened warming protocol is an effective strategy to improve the workflow in embryology laboratories. On the other hand, we also believe that there is still room for further improvement in the shortened warming protocol. The first point is the damage to cell membrane. As you can see, rapid cell expansion was confirmed after transferring the blastocyst to the recovery medium. These cells continue to expand, leading to membrane collapse and subsequent cell bursting. We then assessed the cell necrosis by staining with PI and found that proportion of necrotic cells increased in the shortened groups. These results suggest that shortened warming protocol may lead to over-rehydration, possibly associated with increased cell necrosis. However, it should be noted that the present study was conducted using discarded blastocysts that include a higher proportion of poor prognosis blastocysts. This potentially interferes with the study result, since the strength of cell membrane varies among embryos. In fact, our preliminary data shows that when the blastocysts were morphologically good, there was no significant difference in the PI positive rate between conventional and shortened groups. On the other hand, these differences became statistically significant with poor quality blastocysts. Therefore, modifying the protocol or solution to reduce cell membrane damage may improve blastocyst outgrowth and pregnancy outcomes after shortened warming, particularly in poor prognosis blastocysts. Second, when we applied the shortened protocol, fatty acid supplemented solution did not increase lipid droplet as well as outgrowth areas. Therefore, we consider that some modification to solutions or protocols are necessary to realize the benefit of fatty acid supplementation after shortened warming. So this is my last slide. So in conclusion, the shortened protocol can streamline daily workflows. However, the effectiveness of shortened warming protocol may depend on the warming solutions used. Therefore, each laboratory should carefully assess the impact of this protocol before implementing it to ensure optimal clinical outcomes. Furthermore, there is still room for improvement in the shortened protocol. Therefore, continuous development of vitrification techniques is necessary to further enhance both clinical outcomes and the laboratory workflow. So thank you very much for your kind attention.
Thank you very much, Dr. Effa. So now it was a really nice presentation. So congratulations for that. Very complete, very innovative and informative.